Britton, would you mind doing the roll call? Oh. Sorry.
Okay. Sure. Dr. Maravecchio. Ms. Crane. Ms. Hagan.
Here.
Ms. Hano.
Here.
Ms. Harmon.
Here.
Mr. Piontek. See him. Okay. Ms. Richard.
I'm here, thank you.
Mr. Rocca. Here. Ms. Stewart.
Here.
Ms. Lauren Womack.
Present.
Ms. Angela Womack. Okay, we have 8, and that is a quorum.
Brent, can you add me on the committee?
I can't do that. I'm not
Or
aware.
what you Sure, I was gonna do, I wanna get on this committee.
Oh, not me. No.
Sorry.
It's you.
Oh,
You're the chair.
oh, I'm sorry.
You can-
So you can appoint them to this.
See, resume. I'm like, wait, what?
So would you like to appoint
Who is, I'm sorry.
Mr. Mike Billings
Oh, yeah.
to the committee?
And I'm interested too.
Oh, okay.
Okay, so I'm not on, right?
We're on the education and
So I gotta roll out there.
You can have a break, Mr. Evans.
So just for the record, Mr. Billings, present? Yes.
Yes, I'm present.
Ms. Paradak? Okay. You have 10, you have
I was just, it's a six.
Okay, thank you, Britton. Before we get started, I just want to remind you all of a few rules. For committee members and members of the public attending in person, please raise your hand to speak and wait to be recognized by the chair before speaking. To help the meeting run smoothly, please keep side conversations to a minimum and comments related to the topic we are discussing. For those committee members who are attending virtually, remember you must be on camera and have your first and last name shown to be counted towards our quorum. Please keep microphones muted unless called upon by the chair. Electronically raise your hand to request to speak and wait to be called on by the chair. For attendees electronically raising your hand back to request to speak, once recognized by the chair, your microphone will be turned on. After speaking, the microphone will be returned to mute. Also, the Q&A and chat is to only be used by those needing an ADA accommodation to participate in the meeting. Public comment will not be accepted via the Q&A and chat except for those individuals who requested the accommodation. As for order, committee members in person and virtually will be allowed to speak first. Public members in person will then be called on, followed by public participating virtually who have raised their hands, who have their hands raised. Comments in the Q&A and chat will be addressed last. As with all hybrid meetings, it can be difficult to keep track of those wanting to speak in person and virtually. Please be patient. All comments and questions from committee members and public may be limited to 2 to 3 minutes or less should we run into time constraints. So please keep that in mind. Also, comments about a person's character will not be allowed. Finally, members of the public will have the opportunity to provide public comment before each vote and during designated public comment periods. The chair may also use their discretion to determine if comments will be accepted outside of those times. Everyone should have reviewed the October meeting summary, which was attached in the agenda you have received via email. There's also a copy in your committee packet. And I need a motion to adopt the October meeting summary.
Tony, you'll have to unmute.
Got it. I know. I'll pass.
Okay.
Okay, so Tony Piontek recommends to adopt the October meeting summary. Is there a second?
I, Lauren Womack, second.
Is there any discussion? Any public comment? Okay, based on the updating public meeting law, we will now do a roll call vote. Britton, can you please do the roll?
Dr. Baravecchio. Sorry, a yay would be to pass the October meeting minutes, a nay would be not to pass it, and abstain if you wish to abstain.
Yeah.
So Baravecchio. Dr. Baravecchio, yay. Ms. Crane? Ms. Hagan?
Yes.
Hagan, yes. Ms. Hano?
Just
Ms.
but
Hagan,
no,
yes.
and that is a huge twist sometimes.
Didn't make the law, Ms. Hano. Ms. Harmon? Ms. Harmon, yes. Mr. Piontek? Mr. Piontek, yes. Ms. Richard?
Yes.
Ms. Richard, yes. Ms. Lauren Womack?
Yes.
Ms. Lauren Womack, yes. Ms. Tangela Womack? Okay, Mr. Billings?
Yes.
Ms. Parent?
Yes.
Great. All right, I'll check a second. 9 yeas, your motion passes.
So thank you, Britton. The motion to accept the October meeting summary has passed by a vote of 9 or unanimous. So first on the agenda is an update on non-contractual activities. We have Julie Hagan from OCBD who will share with us updates from the department. Julie, would you like to get us started?
Sure. So a few updates and then I'm happy to take questions you guys have. In terms of a legislative update, the only piece of legislation that OCDD has specifically is House Bill 829 by Representative Lyons. And that is legislation. Our Early Steps program is required to have something called a statewide interagency coordinating council. We abbreviate that to SICC. And right now that SICC operates under the Governor's Office of Disability Affairs. And so we just send money from OCDD to the Governor's office, and they hired an executive director and then paid travel costs and things like that. We did work with Bambi before on this and have worked with the new governor's office as well. In every other state except 2, other than Louisiana, the SICC position and coordination happens under the program office that the SICC reports to. So I think Wyoming and Alaska are the only 2 other states where SICC reported under the governor's office. So what we're trying to but it's there in legislation, in statute. So we had to do a bill in order to move that operation of the SICC from Governor's Office of Disability Affairs back to OCDD. The members of SICC are still appointed by the governor, so there will be no change there. I have no influence whatsoever, nor does the Early Step staff, on who the SICC members will be. And so there's no change there. It really is just kind of the executive director, and then the operations would then be under OCDD and under Early Steps. At this point, it's passed the House. It passed on the House Health and Welfare, and then it was heard on the floor this week and it passed. So now we'll hear that on the Senate side. The only other one that OCDD is, there's lots that we watch, and I could probably spend 2 hours telling you all the ones we're watching, but the only other one we're kind of more directly involved with in planning is Senate Concurrent Resolution 17. You guys may be familiar. There's a program called the Medicaid Purchase Plan program. That plan is still in place, and it is for people who meet the Social Security Administration definition of disability and have employment or jobs. And so they are able to potentially continue to be Medicaid eligible under this program if they have certain income limits. About 10 years ago, they increased or changed the income limits. And so you weren't able to make very much at all. And then you wouldn't qualify for the program. So this resolution and some advocates that we know are asking that we go back to the income limits that were in place before, increased those income limits for eligibility so that those folks with disabilities who are working still have an opportunity to maintain their benefits. The department, it doesn't have any concerns with this bill. There is a fiscal note tied to that. And so we have been studying that and we'll continue to study that. Those are the primary things that we're following legislatively. We are continuing to work on fund spending money for American Rescue Plan Act, Section 9817. I had reached out and you guys saw the council. We have the START team that is really trying to help us do an environmental scan with recommendations for supports in our state for people who have intellectual and developmental disabilities and also co-occurring behavioral health concerns. They felt like they didn't in the initial work they did. They felt like they didn't hear enough from actual people with lived experience. They didn't hear a lot from the folks in rural areas. They wanted to reach out to a few more behavioral health, mental health providers themselves. And then finally to the Department of Education. And so they did come and we had several meetings. We do have one final meeting. They want to make sure that they had heard concerns from the community in terms of the behavioral health services folks can get through the Department of Education, specifically children. So they do have they have a meeting scheduled with Meredith Jordan and some of her team so that we can talk through that. We anticipate getting a report from them that we will share publicly and then working through their recommendations on things we want to implement. We do have an opportunity through some additional funding to be able to fund that. I should have also started with, so when you guys have heard me talk about the American Rescue Plan Act, I've shared with you guys that we had until March of 2025 to spend our money. 3 other states requested and got permission for an extension of that. So more time to spend the money. And so we will be asking CMS for permission to use the Rescue Plan Act dollars to extend them through December of 2025. So instead of March to go through December, which we think it's not free money, but it's free money, but we're going to need more than just March of 2025 to spend it. So by going until December, some of these things that I've been talking to you guys about that we want to implement, it'll just give us that additional time, whether it be for spending or to do pilots or whatever we need, so that we can really make sure that we've fully invested those funds in things that are important for us. We are excited in terms of the technology. We're working with several of the LGEs have said that they want to work with us. We've added some technology services to our waiver, but what we find is a lot of people don't really know exactly what that means. When you say technology, there's, somebody said, well, can you make a list? Well, maybe I could try, but there's a list of 100,000 things that technology could mean. And the different forms. And so, but what we're doing is working with the LGEs to try to set up some opportunities for people to do demonstration. So if you think that you may, if you think technology may help you be more independent throughout your day, then we'd have a location at the LGE where Latan could meet folks at the LGE, let them try this different type of technology to see if it's something, because you can get technology through state plan services as well as through waiver services. So this isn't just for waiver folks, it's for, anybody in our system to be able to go and you could potentially try it and then know better about what you may want to use. And so we'll be doing a lot more announcements in the next month or two. So for our next meeting, I'll have a lot more detail about that. because we're working through the logistics with the LGEs right now on that piece. We are also continuing to do work. You guys have all told me loud and clear we need an electronic plan of care and assessment that people can more easily access and be able to track progress and things like that in an electronic format. We're continuing to move forward, and I'm still crossing my fingers that, especially now that we can have that extension through December, if they approve it, to really be able to fully implement our electronic assessment and plan of care that we've, been building for about 20 years now in different forms or fashion, then we may finally be able to get across the line there. And then finally, I had a couple of questions around we had talked about, and some of you may have heard me testify, that we've asked CMS for permission to use some of the Rescue Plan Act dollars to do a rate study or a rate analysis. And we did just hear last week that we got approval from CMS to use the funds for that rate study. So it just got approved last week, so I don't have a lot more to say about it other than I think I saw Mindy come in. We'll be working with Mindy and her team at OAAS as well as Medicaid on rolling that out and what pieces are. We have already engaged with some of the contractors we have to be able to make sure that happens. So again, I don't have a lot more to report out other than it's approved and we're working through the details there. A few other things that Brenton brought to my attention that they've been getting some questions about at the DD Council is around sunscreens. And we have also heard some concerns at state office around people who would like to have the sunscreen done in person rather than by telephone. So just so that everybody has the history there, when we first started doing the sun screenings, which is the screen that helps to determine if you have unmet needs that can be supported in the waiver, and if you do, then what are the urgency of those unmet needs to help determine if you have a waiver offer. When we started that we actually started it probably 8 or 9 years ago because we first screened everybody on our list. Those were all done in person. And so staff would travel to a person's home. They would do those in person. During COVID, when we shifted to not in person for anything, we shifted those to do them either by telephone or by Zoom. And initially, when we did that, the feedback that we had gotten from folks was they felt like it was fine to do those by telephone or by Zoom, and that the community was sharing with us that it feel that the in-person was necessary, especially because I only have 6 staff that are dedicated to doing this sunscreen statewide. And folks do know that we were having some delays in being able to be responsive and get them done quickly. So with us being able to shift to do them virtually, we were able to really catch up and we were able to really significantly reduce the delays. That being said, we do understand that there is a lot of families who have said that they believe that the sunscreen should be done in person, and that they would be more comfortable having it that way. So that is an option. And it really has been, but I don't know that everyone was aware of that or knew that. So we are doing some work on our end to make sure that people do understand that while our primary means of doing the sunscreen is virtually or through telephone or Zoom, there is the option for in-person. They can request that when they call in to the LGE, or they should get a phone call to schedule their screening. And at that point in time, and this is for immediately, at that point in time, they can say that they prefer to have it in person. Now, we are working on our end process-wise to make sure that we are letting people know that that is an available option, but it may take some time. So if somebody's getting a sunscreen now and you say, oh, nobody has me, it is going to take us a little bit of time to make sure everybody understands that. So people can ask, and it is possible to ask to have that sunscreen done in person, rather than by telephone or virtually. And then we also have and we've received some of the same questions around TEFRA. So I did go back and DD Council, this was back in 2020. When we were rolling out our TEFRA program, and if we need to find some of those resources and kind of make sure folks have them again, we can do that. And we also know on our end, we need to make sure that the local governing entities that are assisting people enroll in TEFRA have all the most relevant information as well. But when a child, so with TEFRA, what the TEFRA program is it's for children under the age of 21 who can be considered eligible for Medicaid regardless of their parents' income, if they meet certain criteria. And so there's actually two different points where eligibility has to be assessed. So what the local governing entities do for us, or the human services districts and authorities, is they assess if a person meets the level of care determination for entrance into TEFRA. And the level of care determination is your intermediate care facility level of care, nursing home level of care, or hospital level of care. And there are certain criteria that a child must meet to be eligible for that level of care. There's also, though, through Medicaid, to be eligible, they also have to go through a process called MEDT. And I always have to look at what that stands for. Medical Eligibility Determination Team is MEDT. And so they do also have to go through that MEDT process. MEDT is different than level of care. So MEDT uses the Social Security Administration definition. And we are seeing and finding that there are some children that are deemed eligible through the level of care, but then when they go through the MEDT evaluation, they are not deemed eligible through that medical eligibility determination team. It is two different sets of criteria that they're looking for. To date, we have, of the 44,784 children who've applied for Medicaid, we've had 110 of them who might have qualified for level of care, but then did not qualify through MEDT. And so the ask of us has been to make sure that the LGEs let families know that information, that even though they become eligible through the level of care determination process, to make sure families understand there's still that MEDT component. We've also been asked, can you just do one and not both? But by federal regulation, we have to actually do both. So a state can't decide that we want to do one or the other. It has to be both level of care determination and the MEDT determination. What we will do on our end is to make sure that it was in some of the original documents that we did, showing that you have to kind of go through both of these processes. We had worked with the TEFRA work group on some of those processes. So we'll recirculate those and make sure that information is getting out, because what our understanding is there's some families who were told that they met the level of care determination, thought they were in TEFRA, only to then get a letter saying, no, you're not eligible because of MEDT. So we'll work on our end to make sure that that is communicated in the way it needs to be communicated to families, and that we help increase understanding. And then the last thing that, Brenton always sends me a list ahead of time of things that he's getting calls about, and it is normally things we're getting calls about too in our office. So the last thing that I had on my list of things was to talk about some concerns folks have brought up around children that are aging out of the Children's Choice Waiver and moving into our adult waivers. And so there is a federal requirement, and you may have heard me talk about it during the public health emergency and some other things. There is a federal requirement that we have to exhaust any available state plan service before we use waiver services. So we can't, per federal mandate, use waiver services in place of state plan services. We hear sometimes things like, well, the rate in waiver is higher than the rate in a state plan service, or, there may be different requirements, but we are still federally mandated to have to use our state plan services before we start using our waiver services. We understand that as we have started to come out of COVID, started looking at different things, some children that are aging out, that in practice, that may not have happened in the way that it needed to. So we have been looking at our processes. We have been working to clarify some of our processes, and the information that's come back to us is, as we've done that clarification, there were some people who were in that period of going from a children's waiver to an adult waiver, and there may not have been adequate time to really plan for and have the appropriate discussion through planning that needed to happen with that transition. So we are working on our end to make sure that we educate everyone, to make sure that folks have. So what should happen is at least 6 months before someone is aging out of a children's waiver into an adult waiver. And I don't give an age because, remember, with Children's Choice, you can age out at 18 or at 21, depending on what's happening. But there should start to have conversation of that transition from the children's waiver into the adult waivers at least 6 months before you anticipate someone would be transitioning. So there should be those conversations. In order, though, because one of the things we've talked about is, can long-term personal care services meet your needs or not? And so there is a process where you have to apply to see if if you are deemed medical, if you have met medical necessity that's required for LTPCS, if that service is something that actually can meet your needs. You can't do that until 90 days before you're turning, I believe it's turning 21. I always get confused on the age, but 90 days before you're age eligible to have that. And so part of the planning process needs to be a conversation around, if you're getting in-home supports, will long-term personal care services meet your needs? If so, start to apply for that, for those, again, at that 90-day period, and to allow for a transition period. Again, we understand that in practice, that didn't happen as we were having these conversations. So we are working to make sure that there is that appropriate, people understand that during that transition period, during that time frame, these are all things that should be considered. Again, so that if we're not sure if long-term personal care is the appropriate service or not, we have time in that 90-day window before you age out to apply, see if you meet that. Then that helps determine next steps in your planning process and individual processes. There may be other state plan services for an adult as you age out. And so again, during that planning process, all of those things should be discussed, should be considered, should be a part of the conversation. And so we're working to improve our education to those folks that are having those conversations to make sure we're all, really on the same page about what needs to happen during that planning process. So I will stop there, and I will turn it back over to you, Brenton, or I don't know if you want me to just open it up for questions about any of the information I shared.
Yeah, I mean, if people have questions, that's perfect.
Lauren?
If you could just say what are the strategies y'all are using to maybe get the information out there? Because it's just, I keep getting frustrated feedback from people. It's not in plain language. I think everybody here could agree. It's extremely difficult for even people that research this stuff to understand. I know that there are platforms, learning web-based platforms that maybe the state uses for state training. Maybe, it can be an, an LDD contract, for some of these things, that the support coordinators can be obligated for mandatory training. And then that way, if there's turnover, there would not need to keep being extra trainings. These trainings would just be available and could be updated by OCDD, with any new information available. And I think it probably could also be available, you know, to the public. And I think another issue, that we need to focus on is making it in plain language, especially for people with disabilities, developmental disabilities. Because, it makes it very difficult for families, even educated families, to figure out what to do, where to go. And I know from experience, it's frustrating and you want to just give up. And I'm sorry, but the excuses just aren't good enough anymore. We have the technology now. It's time to stop blaming COVID. We need to move forward and stop saying we're doing our best and find solutions. And then my other question is, can you share some of the focus groups that you talked about? What are some things that y'all are finding may be promising practices to increase direct service worker workforce? Or some of the summaries of the meetings that y'all have held, maybe some of the outcomes.
Sure. So in terms of the comment on plain language, I 100% agree. And we have begun for all of the items that are on our webpage, doing our best to make sure. We actually have sent several of our staff to courses that help you understand how to do plain language. And Lauren, if you're aware of some platforms, please do let me know. What we've found is there's a few different things that we've tried that are supposed to help things be more in plain language or done at a certain reading level, and they just don't all, because we have to use certain terminology around home and community-based waivers and things like that. It just is not translating well. So that's why we determined that we needed to have folks educated. So we do have our staff who are getting doing some coursework on how to make sure things are in plain language so that we can do better. And I know I hear you loud and clear. It's time to do it. We are trying to do it, but we're not there yet. So I do understand the frustration. We are working on looking at everything though on our webpage to try to make sure that those public facing documents we're not putting anything out yet unless I've had one of my team members who has been educated on plain language take a look at that. I would also say one of the things we're trying to do for the support coordinators, I think there's definitely a need for training, and with turnover, you need to have that recorded and have people do that. But what we've really identified is that there's also a need not just for training, but for coaching. And I think a lot of people use those terms the same way, but coaching is different than training. It's not watching it. It's on a, kind of a recorded, but how do we get out, get ourselves back in the field more than we were able to be and do some true coaching around person-centered planning, around making information available. And so you'll be seeing us do more of that coming up. In terms of the focus groups, we have a few different focus groups. We had a few focus groups around discussion around value-based payment models. And so one of the things that we are allowed to do through CMS is you have the regular rate that you pay to providers, but you're able to set certain benchmarks that providers meet that are related to providing quality services. And if providers meet those benchmarks, then they're then eligible for a value-based payment. So we've had a lot of discussion a lot of feedback from different groups. We had people receiving services as well as people providing services and advocate groups at the table. Where we are with that is we anticipate next month being able to roll out to folks, I think it's either next month or the month after, what those value-based payments will be. There will be different things that people can apply for to be able to do that. So we had that focus group has started and stopped. We have a second focus group or another focus group that is for specifically for people in self-direction and who use self-direction. It's focused on people receiving services, but we also have support coordinators, local governing entities, and the fiscal intermediaries at the table. And so we are where we are with that group is we spent a couple of meetings doing an exercise that we call what's working and what's not working, and kind of coming up from each person's perspective. So it was from the person's receiving services, but then the LGEs had some things from their perspective that wasn't working. So we had a list of about 25 things that everybody felt like wasn't working and needed some systemic attention. We took those 25 things, sent it out to all of our members in the self-direction advisory group, and said, we want to prioritize these. So you guys tell us what your priorities are. We're going to eventually address all of them, but what are your priorities so that we can tackle things one at a time? We got feedback from folks around those priorities. And now what we're doing is taking those in priority order and going through each one of them with that self-direction advisory group and working through it until resolution. The thing that was first and foremost in everybody's mind, if you use self-direction, you should be familiar with something we call the self-direction handbook. And while we had recently done an update to it, folks felt like that needed more attention. And so that's where we're taking chunks of that self-direction handbook at a time and getting it updated so it can be a useful user guide. And I think, Lauren, to your point, it'll be super important as we're doing that update that we make sure we're using plain language and thinking about things like that, looking through that lens as we continue to update that. And then the third focus group the third group that I talked about earlier was the Administration for Community Living, ACL, which is a federal, I think they're part of the part of the federal government. They have started a resource guide, and it's an entire web page dedicated to strategies around addressing the direct support workforce crisis. They have offered for states to apply for a technical assistance grant. And where we are there is in the process of applying. If selected for this grant, then we will, be at the table. We'll be pulling in community members to be at the table with us as we participate in that technical assistance opportunity and really look towards what are things that we can do that will make a difference for our direct support workforce. So those right now are the three main types of groups that we have going on. Is that what you were looking for, Lauren?
Yes, I had asked you before when you brought up the value-based payments. Is one of the criteria anything that would require the funds to paying the direct servers work, more funding for value, for performance, when any of their performance measures or evaluations? Or would it just basically be providers, and then they would have to take those funds and do what they would do with those?
Yeah. So, and I'll with the value-based payment, I have brought that back, and with the value-based payment, I don't know that we're able to mandate that it would go to direct support worker pay. They were looking at what we could do instead is say, if an agency is paying their workers more than the $9 an hour that's required, that might be something that they could submit to us and we could consider reimbursing the provider or something for a value-based payment for doing that. But there's nothing we can do within the money that's allocated for value-based payment. That money does go to the provider. It doesn't go to the worker. So I was able to confirm that.
Okay. And then I just had one more thing. Like I understand what you were saying about the coaching versus just the information. I'm on the LRC and they're having a similar problem with their certified rehabilitation counselors. There aren't enough for vocational rehabilitation and they aren't properly trained. They are in the process of getting a training system for all their new counselors that they're going to use for training. So it might be something to reach out to Melissa Bayham, who's the director, and see what she's using. Because I'm a certified rehab counselor, and it's similar in that you're a counselor, it is skills. It's not just information. When you're a support coordinator, you're a case manager as well. And it's more than just the information. It's about the tools to convey it. Too. So I just wanted to share that with you. And then the last, I read that CMS was in the process of coming out with a rule about that workers had to get 80% or something of some kind of the funding with the rate.
Yeah.
Can you speak to that, or is that
Sure. So it's called the Home and Community-Based Services Access Rule. I was in a meeting not last month, and CMS assured or asserted that it will be out as a final rule before April 30th or 31st. It will substantially change the way home and community-based services are provided across many different avenues. There is language around critical incident reporting and abuse and neglect reporting and investigations and follow-up. There is information around information technology and how we do things. There's information about a grievance system. There's more stringent requirements to have people using services at the table for any and all Medicaid focus groups specifically. So that'll, include us, but even more globally at the Medicaid level. It also requires that we have transparency with our rates and services, and that we look at rates. And one of the requirements within that transparency and within looking at rates is around a requirement that in the proposed rule, it was a requirement that 80% of the rate that a provider receives has to go to the direct support worker. And that was what was in the original rule. CMS has referenced that again. When the final rule comes out, we'll know more. There's also some transparency around reporting on your waiting list and things like that. There's a lot of discussion around this. In June, the National Association for State Developmental Disabilities Directors is doing a policy forum that we're going to have federal partners there and have states there who started to try to tackle some of these things. And I've shared, and Mindy and her team and OAS have looked at it through, it'll impact anyone who receives waiver services, home and community-based services. So it'll impact the behavioral health population, the aging and adult onset population, the IDD population, and Medicaid and the Medicaid services. So we think, and it originally gave us 3 to 5 years to come into compliance. A lot of states said, we think these are great ideas, but when you're talking about having to do things through technology, it takes us 2 years just to go through a procurement process with a vendor. And so we really are going to need more than those 3 to 5 years to get us kind of across if there's anything tied to IT. But yes, I do anticipate in my upcoming DD council reports to this group as well as the full council, you're going to hear me talking a lot more about the access rule, and you're not going to hear me shut up about it for at least 5 years, if not longer, because it'll have substantial changes for all home and community-based services to come.
Thank you for answering my question.
I have a question,
Okay, Jill.
but Mimi was before me.
I don't know, I think.
You're
Oh,
You're one part.
I know. Did you say something about the HCBS access rule? You said it's coming out on April 30th?
It will have to come out before then. So I'm not really an expert in things that around this nature, but what they've explained to me is that because this is a presidential election year, if CMS gets this rule out after April, so if they get it out after May, there is the potential that Congress could take action to try to block the access rule. If they get the rule out before April 30th, then Congress can't take action to stop it. And so they're trying all they possibly can to get it out before that April 30th so that they don't have the potential of congressional action to stop it. Does that make sense?
Okay, yes.
Any other questions?
I'm gonna just. You're speaking to me. All right, so my question's about the sun screening and the sun scores. What happens to the twos, the ones, and the zeros?
So, the original plan for people who had a 0, 1, or 2 is that we would go back and we would rescreen within, whether it be a year or 2 years or 3 years or 4 or 5. I'm not remembering the exact number depending on what your score was when we would go back and rescreen. We are still trying to do that, but there's delays there because, again, what we found is that was one of the delays we found by having only 6 screeners, and we are working to try to get more resources to be able to do the sunscreens. But we were having to do this. We have to do the sunscreens for folks who initially come in, as well as folks who are asking for rescreens, and then we were working on those 0, 1s, or 2s. So our priorities are those people asking for rescreenings because their situation has changed, and the initial folks. And we are still working our way through the 0, 1s, and 2s, but it is taking us longer than we originally anticipated it taking because I don't have enough resources to keep up with the volume. We've assigned different people in our office to be able to participate in doing those so that we can try to, but at this point, if you have a 0, 1, or 2 and your situation changed from when you had your original screening, then I would suggest that you call the local governing entity, let them know that that your situation has changed from when your original screening was, and then you will get a rescreening. Those are prioritized sooner than us trying to get the 0, 1s, and 2s, because we want to make sure that if you do have had a change in your situation, we can get there. So, again, if your situation changed, please do reach out to local governing entities, let them know you need a rescreening, and then we will make sure that happens.
So this is a personal situation, just off the cuff, it's an odd one. My 3 kids, they just turned 18. I did sunscreening for 2 recently, and they said, oh my gosh, it's been 7 years since your last sunscreen for your son, the 3rd one, because they're triplets. Nobody seems to be able to tell me how to nobody wants to rescreen him. And the situation changed the day after the lady left town 7 years ago. And I've been trying ever since. So what do I do if the lady I talked to who did the screening for the other 2 kids can't even get me on a list? So
Yeah, so if you have an individual specific question, you can send that. We have an email address. It's OCDDINFO. So that's OCDD info, OCDDINFO. And there's someone who monitors those throughout the day. They'll send it to the appropriate person. Derek White is the person in our office who's over the sunscreen. So they'll get it to him so that we can make sure that someone's able to get back with you to get that screen scheduled.
or any kind of backlog on the rescreens, or
I'm sorry, can you say that again?
it happens faster on the rescreens.
Yeah.
How fast are you looking at, because I have other members in my region that are asking also.
The last information they gave me based on the data that we've reviewed is that with the rescreens, they're able to do them within 2 weeks.
Okay, so it's about 2 weeks. Alrighty, and then let's see. Going back to the second part of the TEFRA process. On the second part of the TEFRA, you have to do the whole long-term care part, and then the 90L part of it, and then the MBTT one. Am I right?
Well, you don't have to go through the level of care first. When you apply, they start both at the same time. We're just finding that people are typically getting through the level of care process faster than they're getting through MBDT, but you don't have to wait till one finishes to start the next.
So what kind of information are parents going to provide for that exactly? Is it the same as applying for Social Security? Are they uploading school documents, medical documents as well, or are those released in the net?
I'm not 100% sure. Let me see if any of those resource documents that we have there. I believe that in those documents they have the information, but if not, I'll ask our team to get that added so that we can get that information out.
Thank you. And then on the changes to the self-direction handbook, are those online yet, or are they still being done and updated in chunks? Talk about looking.
Right. No, we've just started that process. So, right. In fact, I think there's a meeting this afternoon that conflicts with this.
Oh, it's that name. Okay.
Yes.
All right.
Yeah.
I have a member that's trying to go through the process right now. He's like, this doesn't apply to me. I'm a family. I was like, yeah, but they're looking at you as if you're the employee too. So you have to kind of look at it that way. But he had a whole bunch of questions, and I was trying to see if there was something to get access online or in any way to help him. Okay, thank you.
Okay.
And I have one hand raised.
Hi, so I would like to suggest I'm currently going through the transition process with my son, and I can go into detail, but I will save everyone and respect y'all's time. I would like to suggest that we as a whole, as a community, all organizations involved work on some kind of document or booklet to give to families early on in the transition process so that they have an idea of what all of these processes are going to look like, what they're responsible for doing, what it all entails. And I'm talking about guardianship, through waiver transition, through planning for after high school, all of it. What are the options after high school? What are your options for guardianship? What the transition from children's choice waiver to adult waivers and whatever services look like. This has been a really stressful process on me as a single mom. And I can only imagine that our families who aren't familiar with these processes and procedures are giving up. And it's a lot. It has been very taxing. The process was started at 2 months and 2 weeks before he turned 21. And so that's even late to start this process. Everything is working out. We've had the in-home assessment for LTPCS, but I've been planning for this transition, knowing it was going to take place for at least the last 2 years. I feel like I've been planning for a lot longer than that. And I did not find out about having to apply for LTPCS, which was my responsibility, until 2 months and 2 weeks before his 21st birthday. So I would really, really encourage everyone to work on something to give out to families and individuals with disabilities on this transition process. It is, everything is changing at once, and all of their doctors change too. Keep that in mind. And some have more doctors than others. And so it's a lot going on at one time. And if we can make that easier for families, we need to. So that's all I have.
Thank you.
And we have one other hand raised, Miss Kathy Dwyer.
Thank you, and excuse any background noise. Getting back to the value-based services, I would like to strongly encourage that we do include what percentage of providers paying more than $9 an hour. I think that's something critical given the shortage of workers and what it boils down to. A lot of people are not receiving the services that are in their comprehensive plan of care because of the shortage of workers. So I think that's an important component. It shows how the providers are managing the funds they are receiving. Also, Julie, I know you and I spoke about this. I also encourage you to make sure all providers submit the required audit reports, and those audit reports be used. Whether or not they submit them be used as in the value-based system, and whether or not there aren't any negative reporting in the audits. I'm not sure what the appropriate term is, but those audit reports should show any findings that are concerning, and if there are concerning findings, then that should reflect on the value-based services.
Okay, thank you.
Thank you for those updates, Julie. Next on the agenda is an update on Families Helping Families of New Orleans. Members, we have been discussing Families Helping Families New Orleans since the summer. The center is currently on probation due to concerns about center management and functioning, which was brought to light in their fiscal 22 legislative audit. In your packet, you have an updated quarterly report, which the center has been providing as a part of its probationary status. And you also have a copy of the center's fiscal year 23 legislative audit, which was recently released via the legislative auditor's website. Before we begin with questions and discussion, I would like to turn things over to the center's executive director, Aisha Johnson, who will share with us the things the center has been working on this year to address council and member of the public concerns. Ms. Johnson, you have the floor.
So, this has been a trying year for the center with losing the additional funding and being on the probationary period. And I am actually grateful that we did the probationary period, because it allowed me to look into a whole bunch of other stuff that was, I think, a little bit left to the wayside during those periods of time that we had those audits. I of course released that last bookkeeper. We actually contracted with a new bookkeeping company. So it is an outside service that meets with me often to make sure and ensure that things are going correctly. I've been able to share every month the reconciliations that have been done monthly. I've been able to share our quarterly updates, and in those quarterly updates, not only am I sharing the financial status of the organization, but I'm also sharing the additional things that the center is doing. So how we've increased our advocacy efforts, expanded program impact, what we've, the 0 complaints that we have received since the last complaints that we received, which was, I believe, during the summer around that time, that all of this came to light. We haven't received any of those. More community engagement with less stuff, with less funding. We've still been able to meet all of the organization's needs and meet our mission and vision, which is always the goal, to ensure that the families that we serve are served and are served to the best of our abilities. We have had a new audit. There were still some unresolved things that needed to be fixed. However, we did make strides and we did resolve a lot of the other things that were included in the audit. We were able to go back because this is still financial record keeping from the previous bookkeeper. And we were able to go back during this audit for our new bookkeeper to try and start correcting all of those things once we received this audit. There was one thing that was unresolved was engaging an auditor in enough time to have our audit completed. We actually engaged our auditor in September of this year. They said that they could have the audit done by December 31st. I mean, that's September, October, November. That's 4 months. But they still didn't have it. We still weren't able to accomplish getting it done by December 31st. What I've done to rectify that is I have already verbally engaged with the same auditor already. And so at the end of the fiscal year, which is June 30th, we should receive our final closing of the books at least by July 15th, I believe, where everything from that end of the fiscal year has already come in for her to close the books. And then the audit can begin end of July, beginning of August. The reconciliations was also one thing that was unresolved, and that was because the new bookkeeper had to go in and redo reconciliations or do the reconciliations that weren't done at all. And so that's why we got that hit. However, we have been submitting our reconciliations monthly to the council, and those have been being done in a timely manner. Supporting documentation was also one that was still unresolved on the audit. Out of the 45 documents that they requested, 40 were submitted. The 5 we found were identified in QuickBooks. So for instance, there was an $85 invoice, or she had it under direct mailing or something, and it was in fact another company's invoice. So that's why the invoice was unable to be located until after we were able to sit and match those things and then correct those in QuickBooks. I did take a QuickBooks course just to update myself and to be a bit more knowledgeable of how that program works. Within the organization, I'm not allowed to go into there and change numbers and work with numbers and all of that, those different things. I work along with the bookkeeper and making sure that all of those things are reviewed and put in correctly. And so it's been really different working with an outside entity that is very professional and more and not lax at all and just on top of me and on top of our books really, really well. And so I believe that we are headed in the right direction, as you guys could see from the updates that I've been providing. We are, headed in the right direction, and we strive to continue heading in the right direction in hopes that when we do our next audit, which is the 2023 audited financials, that we will have even better outcomes and less unresolved items. You guys have any questions for me? Yes, ma'am.
So what is your title again? You are
Executive Director.
okay. What happened to the search for the
So we started the search and we got a few resumes, and they weren't qualified for the job, or when they got to the portion of pay, it was not in the pay grade that they wanted. So right now I am fixed or on hold until we we find a replacement or something changes.
I had one question.
Yes.
As I was looking through the audit, there was one that they recommended that you all have like upload into a cloud.
Yes, for our receipts and invoices and like our mail. So we have implemented a mail system. So anything that comes to the mail, Ms. Charlotte will scan it, and we have a cloud that it goes to. So now whenever he needs something, it's submitted electronically. So I don't have to go and look through, paper receipts or anything. It's all uploaded to the QuickBooks cloud.
I have another question. You have on here community engagement and partnerships. What type of partnerships have y'all ventured into since? I know there was some complaints.
Mm-hmm.
And there was a lot of complaints about community engagement. So what type of activities are you guys doing now with less money than you had before?
So we're trying, well, what we've done is we've gotten more into the parishes that we hadn't been able to get into a lot, which is Plaquemines Parish. And so we work with the Plaquemines Parish Community Care Center, and we've been having our staff go out there and visit the clinics, visit with the schools, making sure that everyone knows about Families Helping Families. They know our complaint process. If not, we've even added that to our website, a complaint process, like what are the things that you do if you feel that, someone at HF is not addressing your needs, or, what are the next steps? We've done partnerships now with Nord and different schools. We have ventured on to different boards, different, I'm sorry, I'm losing train of thought, but it's different boards that we all will go and sit on to provide input on special education services, letting families know that Families Helping Families is there. We've been going to autism walks. We've been going to different community events, handing out our information, those are things that we've always done. But we wanted to try and increase that to make us more visible, because since COVID, we hadn't been able to get out, more, like a lot. And so now we're just out there more. We have our Computing for Youth program that we've started. And so we have been working diligently with LRS, with different employment agencies. So we're starting to get out there more with a lot of that. But And we're consistently making new partnerships every day. We've actually started getting MOUs signed to show that, we're partnering with you. You can call on us. We can call on you whenever it is that you guys need us. Yes, ma'am.
Just, maybe a suggestion, in your next, presentation. It's really helpful when, the agencies come when they can give us more, quantitative data. And maybe specifically what events you went to, how many people you sent, things like that, just broken down for more transparency and just to show the magnitude of the different events that we did instead of just very general.
Right.
So just being more helpful in the future.
Sure. We actually have a bigger report that we do monthly, and it has on there the amount of all of the individuals that we've served, all of the workshops that we've done, all of the information that we've disseminated that month, and all of the workshops, the names of the workshops that we've done, the amount of folks that have attended. So that's something that I can actually submit if that will work. With that, or is that?
Yeah, that would be helpful.
And actually, Lauren, and I hate to chime in.
Oh, I'm sorry, oh, did any packet?
Yeah, in the packet, we have a chart that kind of
just one chart?
information. Yeah, it's the performance data. But just keep in mind that they turn in their quarterly report on the 10th. So when they turn their report in, their form was already created, sent out to you guys.
Okay.
So their information is not completely updated on here. But if you need the numbers, I have the numbers for the.
Yeah, I just.
But
I was
that's
looking at
the next
this.
Oh, yeah, that.
Yeah, we didn't know, I didn't know it's all together.
No, thank you. And good job. Most of us.
Is there any other questions?
Oh, yes, Brandy. So part of the probationary period was the leadership assessment. So there's been some troubles to get that done. So I just wanted you to explain kind of where you're at, what the barriers have been, so that everyone's aware.
Yeah, so the type of assessment that was requested, we can't find anyone that does it. And so we had a performance, an assessment that I did with my entire staff and all of us. A lady from an HR organization came and she did this assessment on all of us to see what our level of leadership was, what our learning styles was, and our leadership styles. And so I actually had reached out to her to see if that was something that different that she could do based on what was requested. And so the first thing she said was that wasn't good enough. And I was like, I don't think so. So we have to figure out, I've reached out to several different online platforms to try to find that specific leadership assessment, but it's been no luck at all. And so I'm actually just waiting for the lady who did that first assessment to see if she can tailor something to that, to what was requested, but that's pretty much where we are with that now. But I've been trying since we got the probationary thing, and it's been really, not that's the only thing that really hasn't been easy for me to find, get done.
Yeah, and I think that, because I looked at that assessment type thing that was done, and I think the concern there was it was not person specific. So it wasn't necessarily looking at you as an individual based on conversation. It was more of like you were this type of personality, or you're this type of leader. These are some of the strengths and weaknesses of this type of leader.
Yeah.
As opposed to like, this is what Aisha does, this is how she does it, this, and then be like, these are great things, these are some concerns. I think that's where I fell with the assessment, was not covering specific you and your supervisors. It was just more of a general, I could take it and possibly get the same results. And it says we have the same strengths and weaknesses, but it doesn't necessarily address my personal strengths. I think that's what I was looking for. And that's what was discussed in the meeting. Oh gosh, when was that? July?
Yeah.
So I think that's what you were alluding to, that particular thing, you haven't been able to find someone to do.
Yeah, and I've asked around, you know, if anyone knew of anyone who, you know, does this or have had this done, and so.
So when you had trouble getting someone to do the leadership assessment, did you contact the council and?
Yes.
Oh, okay.
Yes.
Okay.
And I've even asked if they knew anyone that we could go to, because I had been having that issue. So yeah, I've definitely kept them abreast of, you know, what I've done, and yeah.
Okay.
Just an update on like the reduced funding, how has it impacted your center? Tell us about what cuts you've had to make or what decisions you've had to make to offset. Because part of what you just discussed was a lot of things you were already doing, you're still doing, and you're making it happen. So what has happened with that lack of funding? Like what sacrifices have you had to make at your center? What changes have you had to make? Just so they can get a picture of what that funding was utilized for, what it's no longer being utilized for, and how that's.
Right. And I think the biggest thing was for me as a leader, and because this was something that happened under the leader's eye, that I didn't want to impact my staff real big. And so what I did was I cut my salary by a whole bunch, at least by 30 or 40%. I cut my salary so that I can ensure that my staff would still have a living wage, because most of the grants and the other contracts that we receive are totally tied to deliverables. We do have deliverables for the DD Council. However, we are able to use that funding for operations as well. And so we also have things like our audit, which is $12,000 every time, and that's included in that. Then we also have, you know, of course, office supplies. I made cuts there to the meat of the bone. I didn't want to cut anything that was dealing with making sure that the people that we serve did not get the services that they needed. And so I just basically, I work all the time anyway. So it's not like, you know, I'm not doing it. This is for me, and I think for more directors, when we have these conversations, these are not jobs for us. This is a passion for us. This is because we have children with disabilities. This is because we have family members with disabilities. This is because we want to make a difference. So even when we had full funding, or even back when we didn't have full funding, there was time, and my staff could attest to this, there was time where I would always cut my salary first, because the most important thing is them out doing the footwork and making sure that services can be done for our families. I never, ever want our families to go without having services in that region at all. It's a big region. There's always a need every day. And then my staff have family members who have children with disabilities. They are people with disabilities. They have, you know, they get Social Security, and they can't get, you know, they have to have this living. And so for me as a leader, I'm going to take that on and make sure that my staff is able to continue doing what they need to do to make sure that the population we serve is never underserved. And so the meat to the bone cuts were You cannot have paper clips. You gotta find these other paper clips somewhere else. We will recycle staplers. We will share staplers. No, you can't have a new mouse. Let's figure this out. Use the actual thing. So those are the types of things that I cut, like those, those things. Only make these copies. If we can send people things electronically, let's do that and let them print it out themselves. Those were the places that we made cuts at. I put a cap on travel. And so it's only a certain amount of travel that you can do. So we want to make sure that we are traveling to the most important events. And sometimes my staff will just do it and not ask for reimbursement. And so, and that's what Families Helping Families is all about. So, we've had this big, huge bump in the road with these audits. I have woken up from the trance that I was in from COVID and all of the personal things that I had going on at that time, where I was not solely focused on, solely letting this person do her job and believing that she was going to just do her job. So now that is no more. And I feel that we are definitely making progress. We are a center that love what we do. We take cuts every year. We fight for cuts every year. We're at the legislature every year, nonstop. So it's more of what we believe in, than the cost of what it is.
I have a question. So Aisha, I'm just asking about the board meetings that you guys have. How often are y'all having board meetings?
Quarterly.
And how do you advertise for them?
We do it on our, so we have it outside our door, and then we'll send it out through our constant contact. We have a person that sends it through our constant contact, and I believe sometimes Ricky or one of my Facebook people will post it on the social media pages.
I'm just wondering, do you guys ever have public members attend the board meetings?
It's open, everything is open to the public, so.
Yeah, so do y'all ever get any public members?
Sometimes.
Okay.
Yeah.
So I know one of the things in the FY 22 audit, because the most recent one was 23, 24. So in 22 audit, there was cash flow concerns. Some of what you just mentioned, looking at more administrative cuts, office supplies, things like that to make those reductions without impacting services and programs. If you would receive your full funding back, whatever that may be, we haven't gone through the legislature yet. I would imagine some of those corrections will be still in play, right? It's going to be more fiscally responsible with the money. But one of the things you had mentioned that you want to do was look at other opportunities for financial stability, like fundraising and things like that. Have y'all been able to come up with game plans for that? Have you been able to do more fundraising to like what's
and
those steps?
One of those
center management.
One of our updates, we every year we have our champion awards where we honor individual champions in the community who have done great things for the disability community. And we also use that as a fundraiser. And that fundraiser brings in a lively, this year we brought in about $45,000. And I think because we honored Gail Benson and Congressman Troy Carter. And then we always honor a local school teacher or a community activist within the community to be honored as well. But it's a ticketed event and also a sponsorship event, and people buy sponsorships. And so that's one of the things we do. And then we do a lot of grant writing. And we get some, we don't get some. And but we've been able to, secure funding from that. That's our biggest fundraiser. And then in between those times, we're writing grants and asking for individual donations and so on and so forth. And our board, donates, funds as well.
Okay. And so within this time frame, so July to now, has it increased, like your seeking of donations and fundraising and those types of things? Or like the amount of effort and the amount of activities that are happening, or do you think it's pretty much been the same as previous years?
I think it's been pretty much the same. I know that, well, last year we did raise a little less for our champion award. I think the bigger the name, the more money that we get for people to come in. And so I think that's why this year is really a big amount that we got. So and then, you know, I always seek opportunity for also donations of office supplies or something to that extent, you know, so I'm always seeking something. And also the staff as well, they do their birthday fundraisers on social media. They do their own fundraisers on the side, so.
Oh, sorry.
Okay.
I had one question with the executive director's salary. I just wanted to know, like, I think I may have saw the posting, but are you offering at the salary that you, like, is it the deducted salary that you're offering?
Yeah.
So what is that?
43.
43.
For the new director, is that what the question was?
Yes, for the new director, you're offering 43,000. And that's currently yours.
Yeah.
So. Is there any other questions? Or public comment?
Okay, and I have a question, but I don't wanna sound dumb. So if you have on the job posting what the salary is, why do people come in the interview and say the salary is too low?
Yeah, it's not posted. We don't post.
Oh, okay.
Oh, I was going to say.
Is there a reason why the pay is not posted?
No.
I mean, maybe you might eliminate some of that, you know?
Well, some of the,
yeah.
Well, I think what the board is doing now, because there's also, there's also some other positions that may be eliminated, and so there may be a chance to raise that salary. So we don't want to post it and then that's not it, or it could change, or maybe we put a range. You know, that could be a conversation to be with them.
Salary range.
Yeah, salary range in there.
That way y'all get.
But you know, who knows, I might decide to stay on.
Yeah, that too. That too.
I mean, because I'll work for $43,000. I mean,
that's what you're doing now.
Right, it's.
So if you stay on as a new director get in, what would y'all do different not to be in the stage we're now?
We're already doing it. I'm already putting in the work, especially through the probationary period requests, the documents. we've done, I actually have a new, finance, person on the board. And so he's actually looking at some new stuff to implement. And so, things are in the works and, progress is being made. And so, all I could do is continue pushing, for change and, and making and fixing things so that we're not here again. And, and I can just tell you honestly that before this, I've never been here at this table. I've always been at public comment. So I've never had any issues with the DD Council or anything, with except this. And so I'm pretty sure, with your support, with the DD Council support, and with the support of staff and the FHF directors, that we can get right back to where we were before this.
So is it your intention, like, to rectify all the issues and stay as the executive director?
It's my intention to rectify all of the issues.
And stay as the executive director, or
if I stay, or, even if I leave, I would still have to support that new incoming director. So I'll still be around to help with that. I really believe that I don't want a person to come up and inherit this mess. I would really like a person to come in and this has all been rectified and cleared and have a fresh start with you all. If that, if that makes sense to me, or how that makes sense. For you. Thank you.
Are there any other questions or comments before?
So I was waiting to see if somebody said anything, but so there are some decisions that need to be made.
Yes.
So our contracts start over again in July. Right now, we don't know if we have $507,000 to work with for our centers, if we have $1 million. That's still to be determined. The budget is heard in appropriations next week. It'll be voted on. It's got a long way to go after that. But since the council made a decision to cut funding in half for FHS NOLA, he thought it'd be best to bring it back to determine what you would like to do moving forward in July. Again, we have to start writing contracts very soon to determine if you want to restore funding, to determine if there's any additional information you would want on a regular basis from the center. What are your thoughts, essentially? What you take away, you give back, or you don't. It's kind of, it's back in your hands since that's the action that was taken in the past.
I guess I can go to answer you, Brenton. My thoughts are based on the quarterly report. I just felt like with the first, I feel like they're doing fine with the less funds. So let's keep it at the lesser funds with the continued quarterly updates since we have the same executive director. So continue the quarterly updates and keep it at the half funding. Are my initial thoughts.
I think we should, if you're making those changes with the less funding, like she just said, I'm just reiterating, she said, in order to prove yourself that you can earn this money back. So I feel
like a probationary period.
Yeah, like working toward it, you're doing certain things, so I don't think that we need to get the money, the additional funds back.
I'm sorry, I couldn't hear the last part of what you said.
I was just saying, I didn't think that they need to get the additional funding back right now.
Right now, okay.
Right, I'm not saying we never.
All right. And Patty has her hand raised. You can go ahead, Patty.
I've been acknowledged. I'm sorry, I'm getting bad reception.
We lost you.
So I have a question until, Patty gets reconnected. So if we're doing better and moving forward, we still don't need, even though we've made those changes and we've done those things, you guys feel that we still don't need the additional funding. So I'm trying to see if we're getting penalized because we're doing good, we're still doing good, even with the less funds. We're still, I just wanna.
I don't think there is it's just that you're reaching out in the community. You seem like you're covering all your bases with the less funding eventually, but it's almost like you said, a probationary period of possibly getting the funding back after a certain time.
So they are currently in a probationary.
Yeah, we're currently, that's.
Sorry, 1 second.
You'd be looking at an extension, I guess, based on what y'all are saying, but they're already in a probationary period. That was what this year was for, remove the funding, see what improvements you can make. Figure out what we're gonna do moving forward.
How would that affect funding for, if you wanted to increase it as far as contract? Would we have to agree on an amount now if we wanted to increase it going forward? In the middle, can we increase it as they improve, or is it gotta be a set for the?
It's very complicated.
Yeah.
So we have our state general funds, we have to use them. So what we've done this year is our other centers have divvied up that additional funding, the 55,000, whatever it is, that was not provided to FHF NOLA, that went to other centers. If, let's say, you wanna revisit in January and you decide in January you wanna give funding, that gets complicated in how the contract process works. It gets very delayed. We have to actually go through and amend contracts, amend budgets, see if we can actually even get approval to do that. I'm not saying it's impossible, but it's complicated. We also have to figure out that funding, because the other complication is we would have to figure out, all right, let's say you decide halfway through the year, we store all the funding, well, we still have half a years of funding. We can't give them because that's part of the probationary period. So then we have like half our budget, we'd have to amend all contracts. Because the other centers, we'd have to amend the takeaway funds.
We'd have to amend all the contracts.
So.
Oh, sorry. Go ahead.
So would it behoove us to adjust somewhere in between if they've made some improvements rather than fund them fully, or to leave them at that rate for a whole another year?
And we are still, my staff is still, we work harder to still meet the additional deliverables that's in our contract that was included with that, with those additional funding, and we had additional deliverables within the probationary period. So, and not to mention my staff and myself, we still are, still going to the Capitol all the time and making sure that, we can continue receiving the additional funding.
Nicole, I'm sorry, I don't mean to interrupt. I have a member of the committee, Gwen Zoom, that has their hand raised. Ms. Melinda Richard.
Hey, guys. So yeah, this is my thought. Kind of two things in my mind. One is that you mentioned that the audit that they started in September didn't get done by December. And looking at the total budget, I would have thought they'd been able to do that in 4 months. And so, yeah, so I think that where I am is to leave things the way it is until we have a new audit where we can have a better comfort level of whether things have met all the benchmarks that need to be met from an accounting standpoint. It sounds like you're on track, but without kind of in black and white showing that those findings have all been resolved, I'm reticent to, move in a a step forward in more funding. The other thing that I wanted to ask a question of actually is in the third quarter performance data, the NOLA Families Helping Families, the biggest category there, it appears, is the first metric that is the annual target of 2,850 referral units. Is that something that you have control over, or are those people that come to you?
Those are people that call us. Any interaction that we have, that's what that is with the outside.
Okay, because you know,
Mhm.
Go ahead.
And no, and then this number is probably going to grow because okay. Right now it's 2,150 because we don't submit our reports until the 10th, and this is submitted on the 4th.
Okay, so that's a cumulative number is what you're saying. Okay. Yeah, because I just noticed compared to the other Families Helping Families, it was much lower and not really a great percentage of the target. But if it's accumulating, you may make up some speed after that third quarter and the last quarter. Same thing for the training events, because it's substantially less than the others. Okay, I just wanted to understand. I'm kind of a numbers person, the outreach visits, those sort of things. I would say, meeting those targets would be an important thing to speak to the council in a quantitative way that, hey, you're able to function at those targets that have been identified. So, so I guess I just wanted to share with you all where my head was as far as I think it would be to extend the probation until we see those audit reports and have a better comfort level to increase the funding. Okay, that's all I had to share.
Patty, did you want to go ahead and share now that you're connected again? Oh, you're muted. I'm sorry.
Thank you. Yeah, I had some of the similar concerns about like when the next audit would come, but also considering the challenges of maintaining and recruiting staff, qualified staff, at that reduced level over a long period of time. So just wanting to know where like when we would get kind of the next update on how things are going fiscally, and like having that documentation to ensure that we are on the right track.
So the next audit isn't until like I stated earlier, the end of the fiscal year, which is June 30th. And then we possibly, so I've already verbally engaged with the auditor so that as soon as the books are closed, they can start the audit, which should be July 15th, is what my bookkeeper says, is as long as she has all of the things that have come in. All of the billing, sometimes our billing is not on time. Well, we have until the 10th to actually submit our billing. And so funds that are supposed to come in aren't coming in, at that time for her to close the books. So it all depends on when things are in or, so on and so forth. But that is the time frame for that. I can say that although we have functioned and have been fully functioning without less fund, eventually it will come to a point where we will have to cut some of our staff time at some point, because that is funds that, of course, when I cut my salary and then we're cutting that meat, but there's also the fundraising, that we, put towards the rest of the pick up where we fell off and stuff like that. So, it depends on, as we, like, for instance, they continue to fundraise and how we're getting that funding in. So,
Nicole.
So we, from my understanding, they've been on a probationary period for a year, right?
Since July, so not quite a year. This fiscal year. So
Like this fiscal year.
through 9 months, yeah.
Right. And like we said, I hear everybody concerns with not giving them or not increasing the funds, but I know how grant writing works. And I know that, sometimes you get grants, sometimes you don't. And like she said, she probably will be able to operate for a little bit like that, cutting her pay, but we all know we don't want pay cut and you're doing the same thing. So, I mean, I'm just looking at it from all points of view, because if we're gonna cut that, then you know the quality of people we're gonna get cut too, right? Okay, so then we're gonna end up putting them back in this situation again. So I'm just saying, we just need to consider, I'm not saying raise it all the way to the amount that it was, but maybe like meet them halfway or you know, something like that. Because with Ebony and Britton stating, if we change anything, so many contracts gotta be changed. Everything has to be done all the way over. So I'm just saying, just consider that too.
Christine?
I agree with you said, but what about like a step increase?
Right.
As they show, you know, movement to where they're doing, giving us and prove themselves, a step increase. It's like we, you know, like a little raise here, you're doing a little bit more to earn, you know, along with the audit.
I got a question. Sorry, I'm gonna go to Britton because I got a list going.
Yeah.
Okay, I know, Joanne, I just wanted to provide a point of clarity, I guess, that your meeting is almost over. But also, I went and looked at the legislative auditor's website because one of the questions was, when does the audit usually come out? And typically in past years, it looks like most of the center audits have come out around like the March, April timeframe. So if you're waiting on anything for the fiscal year 24 audit to come out around this time next year is probably when you will get it. With regard to the step increase, I would either say you figure out that amount for the, not step by step, because that's a contract. It's 9 contract amendments, every step that you take. So
just figure out an amount.
An amount for it, yeah.
Well, not too much time.
Remember, you're not waiting on us for those contracts to get processed. You're waiting on a very large agency.
So I think the main problem was we said we're gonna put you on probation, but now hearing the conversation, we as a committee never really should establish how long that probationary period was gonna last. And also hearing different comments, like we've only gotten the data 2 quarters since this whole thing started in July. 2 quarters is just such a short period of time to end the probationary period. So just throwing that out there.
Lauren?
I make a motion to take the funding that they're at now, increase it to 50% from that. And then after the audit, see how they're doing. If they're doing well and they're meeting it, be set that date for getting the rest of the funding.
Okay.
I would like to, is Tony? Tony, you're muted.
I mean, it sounds like you have a motion.
A motion's on
the table, so you can't take comment yet until you get a second, but I did need some clarity on.
Okay, yeah. So right now they're
I'm confused.
You mentioned going up by 50%. Do you mean restoring half of their? So we cut, let's say 55,000, that's not the exact number, but it's like
Right.
55,000. 55. So half of that is what you're looking to restore pending results of the fiscal year 24 audit.
Right, and then it'll be the
In full
full.
disclosure, that audit is gonna come out this time next year. You'll be talking about it. The remainder of that funding is not gonna get to her until the next fiscal year. I don't think we would be able in 3 months be able to reprocess these contracts
Okay,
and have just
Yeah,
based on the
no,
timeframe of
okay.
the audit. Yeah.
okay,
So I mean, it might be you want to increase however much for the next fiscal year, and then this time next year, you determine starting July 1, we go back to full.
yeah, that might be
But
more efficient.
the time frame when that audit comes out, I can be able to
It's
get
not
the
gonna
rest of
work
that
like
funding.
Okay,
I don't think.
Wondering
Since
like
she,
what. Sorry, go ahead.
since she did it first, I'll second it.
Okay. I'm start typing.
Okay. But we still gotta vote on that.
Yeah.
Shall we vote to vote on it?
Well, so I guess, since it was your motion, Lauren, are you
can I
looking at?
withdraw or is that not?
Oh, you can unless you wanted to,
Yeah.
unless you're looking at restoring half of the funding that was removed,
Mhm.
pending approval from the legislature to have that money. But restoring half that funding for fiscal year 25, pending the,
What I wanna know is 50% enough to cover, like, to make sure the staff can still work full-time and still,
You might never know.
you know, like, I was, like, whatever that is, like, to make sure that, like, the current staff can still work, that their hours won't get cut.
Because she said she took a big cut of,
But she said she can't continue.
yeah, I know. So that'll go in.
Could we do some, like have more financial oversight, like if they restore the funding, like maybe make a motion or something to have more financial oversight to make sure that the money is being spent properly?
I
Yeah,
think that
that's
was
what
the
we,
original.
yeah, that's what it,
Yeah.
yeah, and we could still submit the reconciliations. You know, that's not an issue. You know, to continue to do that, whatever it is that is requested, everything that has been requested, we've done, and we've been complying with. So the only thing was the leadership assessment.
So is the board of directors is aware of the audit?
Yeah.
Are they overseeing the way y'all spending the money or?
Yes.
And how often do y'all replace the board?
We actually just had a new election, and so they have 2-year term.
Do y'all look for people that's experienced with financial, since y'all in a
Yeah.
situation like this?
Yeah, we have lawyers, we have finance people on the board. And I just want to be clear with the audit, there was no findings of misappropriation of funds or anything like that. It was just bad bookkeeping that they found on the bookkeeper's part and not enough oversight from me with the bookkeeper. So that was the huge issue with that, but there was no findings of misappropriation of funds or mishandling of funds or anything like that, so.
Okay. Lauren, did you wanna restate your motion?
working on it.
I'm trying to,
Or wait,
I'm trying to figure out how to say now.
So.
I think you're understanding.
So it looks like the committee is recommended, or Lauren has put a motion to restore, I put 28,000, because that's about half of the 55,555,
Right.
to make it work within our instead of the 27,77750. So restoring $28,000 to FHF NOLA's budget in fiscal year 2025 with the opportunity to receive full funding fiscal year 2026, pending the financial audit results from fiscal year 2020.
Pending positive outcome.
So when will we give?
When we get the audit.
Okay.
So that's additional funding support staff to make sure that no one like gets cut.
We'll rework the budget to figure it out for them, because this will be in addition to the next fiscal year, and we have a board meeting next month, and that's where we rework the budget, and so we can add this into the budget, and then we'll have a working budget that will know.
So, oh, I'm supposed to put it on the screen. I'm sorry, y'all.
First one, some big letters written in.
If I have to read it, Brent, I'm gonna have to load up.
Yeah, it's small.
I don't have contacts to that.
Computer is not responding.
I can get closer.
Oh, there you go.
It is.
Yeah, that's
It's
better.
not letting me.
Okay, so I can see it.
Yeah.
Okay.
It's up to you.
So the Self-Determination and Community Inclusion Committee recommends restoring $28,000 to, Families Helping Families of New Orleans budget in fiscal year 2025, with the opportunity to receive full funding in fiscal year 2026, pending positive outcomes on the financial audit for their fiscal year 2024. Fiscal year 2024, sorry. And we'll recommend that to the full council for consideration. That was, if you agree with the wording,
Yes,
that was a
yes,
motion
thank you.
by
Yes.
Lauren, seconded by Tony. So now you have discussion and such.
Discussion.
Oh, discussion.
I have a hand for me.
Oh, okay.
And comments.
This is from Kathy Dwyer.
Ms. Kathy?
Oh,
Oh, thank you. Sorry, I didn't realize I had to unmute too. Not to complicate matters any, but with, I heard the giggle. With the amount that you want to restore, would it be possible to require a portion of that be directed toward the new director's salary? So maybe they might have more success with recruiting someone.
I don't think that's the
Good
goal.
idea.
The current ED is.
Can I add something? So the initial, well, I think whenever you guys decided to put the probation in place, you all wanted that money, the additional funding to go towards the debt. And so we contacted legal and they told us the council cannot put those stipulations on additional funding. So we have a contract with them. We have deliverables that they have to meet through that contract, and that's what they're contracted to do with that funding. So we can't put stipulations on the budget.
Yeah. Right, and then as you guys saw from the audit, that we have the debts.
And also, to be clear, this is all based on us getting the full $1 million from the legislature. Because if we don't, then funding remains the same and for FHFL and the other centers get cut, essentially. Any other, oh, sorry. That's your job.
Was there another public? I think there was a second.
Education.
I don't see any other.
So the motion to, restore $28,000 to Family Helping Families NOLA's budget in fiscal year 2025 with the opportunity to receive full funding in fiscal year 2026, pending positive outcomes on their financial audit for fiscal year 2024 is, will be recommended to the full council. Oh, we got a roll call.
Oh, yeah, we have to do a roll call vote. Okay,
Ready to go.
so. Now we're gonna help me make sure it's equal that are on the camera. Let's do that for a second. Just a reminder, you have to have your camera on if you're a member of the committee and you're virtual to be counted towards the vote. A vote of yay would be to restore that funding, $28,000, families helping families NOLA. Nay would be you are against it, and abstain if you feel like you need to abstain due to a conflict. So Dr. Baravecchio,
Abstain.
Ms. Crane, Ms. Hagan. Do we have a forum?
Yes, we
Okay,
do.
just checking. Ms. Hano,
Yes,
what was that?
yes.
Ms. Hano, yes.
Very quiet.
Ms. Harmon,
Yes.
Ms. Harmon, yes. Mr. Piontek. You gotta say it.
Yes.
Okay, thank you, sir. Mr. Piontek, yes. Ms. Bayshard, are you still on? Okay. Ms. Lauren Womack,
Yes.
Ms. Tangela Womack, Mr. Billings,
Yes.
and Ms. Paradan.
Yes.
3, 4, 5, 6 yeas, 1 abstain. The motion does. Great, sorry. On my list. I have no, I'm using a different list than the one they put out for me. Mr. Roca.
Yes. Yes.
Yes.
Yeah, she said, yeah.
Okay,
So that would be 7 yeas, 1 abstain.
the motion passes. Okay, so we will be moving on now to.
So, if I may, Madam Chair,
Yes.
we should, conclude our meeting because all of the contractual updates that we would have discussed are included in your status of planned activities. I would encourage if you have read the status plan activities, please reach out to staff if you have additional questions about those activities. But for the sake of time,
Thank you, Brenton.
we're cutting into education.
Yes.
I move we adjourn.
Yes.